So you've got some knee pain when lunging. What are some of the things you can do to get yourself out of pain and get back to being able to lunge and do other single leg movements like that? So the first thing that you want to look at is actually, it's the easiest entry point. It's one of the easiest things you can do, but it's also probably one of the most uncomfortable things, and it's foam rolling your IT band. Now, if you, prior to this video, didn't know you even had an IT band, then you are in for such a special treat. So the IT band is not really a muscle, it's a tendon. It runs from basically your hip down to your kneecap and then to the top part of your tibia, the lower leg bone, your shin bone, basically. So the problem that it can cause is because it has multiple attachment points. When it gets tight, it can pull on things. So it pulls here, it pulls on your kneecap. So it can be a source of knee pain. Because what it does is it interferes with how your kneecap moves, okay? So when you bend and straighten your knee, your kneecap actually moves up and down a little bit. That's a normal movement. But what happens is the IT band, because it attaches to your kneecap, it can pull to the side as it's trying to slide up and down. That can create some problems with how it tracks, and it can directly cause pain and indirectly cause pain in other parts of the knee. So what you need to do is you need to foam roll it or find somebody to get some pressure on it, because here's the deal. You really can't stretch your IT band, okay? You can try and you can twist and turn and do these different things, but the stretching for the IT band, they're pretty poor. And here's the thing, and I've written about this before about stop stretching your tight muscles, because sometimes a tight muscle is not tight for the reason you think. It can be tight actually because it's overstretched and lengthened too much, right? So then if that's the case, stretching it actually makes things worse. So for the IT band, if people have a problem with it, it's not the kind of problem you're gonna resolve by stretching. So you need to get out a foam roller, you need to get out a rolling pin or some kind of a handheld massage device, whatever you have, and you need to work on rolling from, basically the side of your leg. Do not roll directly over the side of your knee, because you're getting down to that point where it's simply bone and other sort of support structures. That's gonna hurt, but not the kind of hurt we're interested in. So say just above the knee, you'll get up to a point, not quite, so you have the crest of your hip, the hip bone here, and a little bit below that, there's another bone. It's actually the top of your thigh bone, or part of the thigh bone. It's a little bump on the side here, right? So it's right about the height of my pocket in my pants here. Don't roll over that thing either, because that's the kind of pain that you're just gonna hurt something, but there's no benefit in doing that. Stay in between there and roll the leg out. Here's something that I always tell my clients, my patients, when we do soft tissue work and soft tissue work only. And that's what this would classify as. You're rolling your IT band, or you're rolling out your calf, or you're doing some kind of massage type work. The more it hurts, the more you have to do it, because the tissue is responding in an abnormal way. Okay, it's not supposed to be that sensitive, that sort of tender to pressure. If it is, that's abnormal and you have to work on it. Now, it's going to be uncomfortable. I'm not even gonna lie, like, oh, it's not that bad. It's pretty terrible, but you need to do it, because all the other things we're gonna talk about are going to be limited if this thing's all locked up, and it's going to influence movement. So you have to kind of get in front of it, and you have to do that, as uncomfortable and as awful as it can be. Trust me, if you can be good 2 to 3 times a day for a minute or 2 each time, so it's brief. You're not spending 30 minutes doing it. It's 1 to 2 minutes, 2 to 3 times a day, every day for 7 to 10 days. If you can commit to doing that, you're gonna move yourself much further ahead than if you kind of sort of skirt around it. Just commit to it, do it, find a way, suck it up, get through it. It will get better, that much I can promise you.